So today we'll be talking about bone tumors. No disclosures, unfortunately. As mentioned, so today we'll be talking about bone tumors, obviously a big topic, okay? But we're going to be focusing on bone, not soft tissue tumors, okay? That obviously encompasses benign and malignant neoplasms, touch a little bit upon some reactive focal abnormalities, and a little bit about metabolic abnormalities, and gloss over tumor-like conditions. But we want to review the basic evaluation of a bone tumor, okay? Particularly the importance of analyzing its radiographic appearances rather than memorizing long lists, okay? But it does help to know some site-specific lesions, and I'll share some of those site-specific lesions with you along with some memory tools that I've collected over the years. And I'll briefly gloss over some staging and biopsy, okay, at the end. So a patient may seek treatment for a bone lesion because it is painful, okay? Our ears should perk up, particularly clinically when someone presents with non-mechanical night pain, okay? So they'll present with pain sometimes they'll present with a palpable mass, or sometimes, unfortunately, with a pathologic fracture. But oftentimes, these lesions are discovered incidentally by imaging, as we all know. In any of these situations, it's our initial objective, okay, to confirm that it's a neoplasm or find an alternative explanation for the patient's symptoms or findings such as trauma or infection. But once a tumor is confirmed, the assessment of its characteristics, that is morphology, okay, which we'll spend quite a bit of time on, is probably one of the most important findings, okay, and that will tell us whether what we're dealing with is aggressive or non-aggressive in behavior, okay. This helps us to predict, but does not necessarily equate with benignity or malignancy. For instance, we all know, okay, that infection, although a benign process, can look quite aggressive. Okay, so that said, after establishing the aggressiveness, or as one of my mentors back from residency used to say, the tempo of the lesion, okay, combined with some information, as you see here on this flow diagram, okay, including site of involvement, some sprinkle in some patient demographic information, other imaging techniques, and possible tissue sampling, we should come to a formulation of a single diagnosis, or at least limited differential with several choices that are most likely in any patient in any case.